For more than 15 years, my life has been marked by clinical experiences that showed me just how fragile and precious the human heart is. But today, I don't want to talk about what happens in an operating room. Instead, I want to talk about something that hides in a much closer place: the medicine cabinet at home. There are drugs that millions of people take almost without thinking, convinced that they are as harmless as candy. They are used for headaches, heartburn, or to relieve the symptoms of a cold. Yet behind this apparent normality lies a real danger. Some of these medicines can silently weaken the most vital muscle we possess, the heart. These are not exotic substances or experimental therapies. We are talking about medicines that anyone would recognize: painkillers, gastric protectors, nasal decongestants. Precisely because they are so common, the risk often goes unnoticed. And yet science has repeatedly shown that, especially after the age of 60, their continuous use can increase the likelihood of serious cardiovascular problems. My goal is not to frighten, but to bring clarity. The real threat is not the illness itself, but the misinformation that prevents us from recognizing everyday dangers. This is why I want to guide you through 5 categories of common medications that represent an underestimated risk for the heart, explaining why they can be dangerous, how they act, and which safer alternatives can be considered. Let's begin with the first group: non-steroidal anti-inflammatory drugs, known as NSAIDs. These are perhaps the most common medicines in every household. Names like ibuprofen, naproxen, or diclofenac sound familiar because we use them for muscle pain, arthritis, headaches, or joint pain. They work, there is no doubt. But taking them without control, especially past a certain age or in the presence of high blood pressure, is like playing Russian roulette. Why? These drugs block certain substances responsible for inflammation, but at the same time they interfere with the mechanisms that protect the kidneys and blood vessels. The result can be devastating. The body begins to retain water and salt, suddenly increasing the volume of blood the heart must pump. If we think of the heart as a pump, it is like forcing it to push against pipes that are already under pressure. A young heart may cope, but an older one risks failing. In addition, NSAIDs can constrict blood vessels and raise blood pressure. Even those who do not suffer from hypertension may find their values elevated after regular use. And those already taking anti-hypertensive drugs risk having their effect cancelled out without realizing it. The statistics are clear. High doses of ibuprofen or diclofenac are among the most associated with cardiovascular events, while naproxen at low doses seems slightly safer, but the risk never disappears entirely. There is also another problem. Some NSAIDs can cancel out the protective effect of low-dose aspirin, which many people take to prevent heart attacks. So what should be done? The solution is not to ignore pain, but to discuss it with a professional. In some cases, paracetamol is sufficient. In others, anti-inflammatory creams and gels that act locally reduce systemic risk. And when an NSAID is truly indispensable, the golden rule is clear: the lowest effective dose for the shortest possible time. After looking at the risks linked to anti-inflammatory drugs, let's move on to another category of medications that millions of people take every morning, often for years, convinced they are a sort of protective shield: proton pump inhibitors, known as PPIs. We are talking about widely used active ingredients such as omeprazole, pantoprazole, or lansoprazole. Their main task is to reduce stomach acidity, and they are prescribed for reflux, gastritis, or to protect the stomach from more aggressive drugs, such as the NSAIDs we just mentioned. They seem harmless, so much so that many people take them almost as part of their daily routine, no longer questioning their use. But reality is different. If used long-term, they can produce unexpected consequences, especially for the heart. Let's imagine a woman of about 68 who has been taking one omeprazole pill every morning for years to fight reflux. Everything seems to be working. No more burning, no more discomfort. But behind that apparent calm, a hidden change is slowly taking place. At some point, during a routine checkup, abnormal values emerge. Her blood magnesium levels are extremely low. Why is this serious? Magnesium is an essential mineral that regulates the electrical stability of the heart. It is like the conductor of an orchestra who keeps the rhythm. When it is lacking, the heart can become unstable, with dangerous arrhythmias appearing. And the cause, in cases like this, is often precisely the chronic use of PPIs. These drugs, by reducing stomach acidity, also hinder the absorption of vital nutrients such as magnesium. But that's not all. Some observational studies have detected a possible link between prolonged use of PPIs and an increased risk of heart attack. One hypothesis is that these drugs lower levels of nitric oxide, a molecule that keeps blood vessels elastic and flexible. If the vessels become stiff, the ground is set for cardiovascular events. There is another aspect. PPIs can interfere with the effectiveness of certain fundamental drugs for people who have already had heart problems, such as antiplatelets. This means that a pill taken to protect the stomach can indirectly reduce the protection of the heart. The real problem is that their use has been trivialized. These medicines were originally intended for short-term therapy, 4 to 8 weeks. And yet today millions of people take them for months, even years, without ever reassessing whether they are still necessary. Often, the solution could come from lifestyle changes. Improving diet, reducing alcohol and coffee consumption, eating at more regular times. But for many, the pill seems the easiest shortcut. The important message is this. One must not suddenly stop a PPI after years of use, because reflux could return with greater intensity. The safest choice is to talk to a professional, ask if it is truly necessary to continue, whether the dose can be reduced, or if alternatives exist. And if the drug must be taken long-term, it is crucial to monitor magnesium levels in the blood regularly to avoid silent consequences. The lesson is clear. Even what is sold as a protector can have a hidden side. Stomach protection cannot be allowed to turn into a risk for the heart. True protection is born of balance and awareness. After talking about gastric protectors, let's move on to a category of medications that almost everyone has used at least once in their life. Oral decongestants for colds. These are the ones that promise to clear a stuffy nose within a few hours and help us breathe better at night. Substances like pseudoephedrine or phenylephrine are among the most common ingredients. But behind this promise of immediate relief lies a cost that can be very high, especially for those over 60 or those suffering from high blood pressure. Let's imagine an elderly woman who takes a common over-the-counter drug to fight a bad cold. In the first 2 days, she immediately notices the benefit. She can breathe better and feels the congestion ease. But almost without realizing it, she begins to feel her heart beating too fast, her head spinning, and a sense of restlessness. When she is taken to the emergency room, her blood pressure readings are dangerously high, and her heartbeat completely irregular. Why does this happen? The answer is simple and at the same time unsettling. These substances act as vasoconstrictors. They narrow the blood vessels. In the nose, this action is useful because it reduces swelling and allows for easier breathing. But the medicine doesn't stay confined to the nasal passages. It spreads throughout the body. This means blood vessels narrow everywhere, and this increases the resistance against which the heart has to pump. It is like trying to force water through a hose that has suddenly been squeezed. The pressure rises, and the pump has to work much harder. Not only that, these substances are also stimulants. They push the heart to speed up its rhythm and become irregular. For a young and healthy heart, this might go unnoticed. But for a heart already weakened by age or pre-existing conditions, it can be the final blow. In recent years, several regulatory agencies have issued warnings about the risks of pseudoephedrine and phenylephrine. Some studies have even linked their use to rare but serious syndromes involving the narrowing of blood vessels in the brain, with potentially fatal consequences. This confirms how powerful and systemic the effect of these drugs can be. The real problem is that they are available without a prescription. Many people buy them in supermarkets or pharmacies as if they were simple candies, without reading the warnings and without realizing that a pill to clear the nose could become a threat to the heart. Yet, especially after the age of 60, or in the presence of hypertension, arrhythmias, or heart disease, the risk is real. Fortunately, there are much safer alternatives. Nasal sprays based on saline solution, steam inhalations, the use of humidifiers at home, or corticosteroid nasal sprays that act locally without affecting the whole body. These solutions may be less immediate, but they are infinitely safer for those who need to protect their heart health. The message is clear. Temporary relief for the nose cannot turn into a danger to life. Breathing better for a few hours is not worth the risk of a hypertensive crisis or an arrhythmia. Knowing this means being able to choose consciously and, above all, to protect the heart from avoidable risks. Another delicate chapter concerns the drugs used for mental health. Some older antidepressants, in particular the tricyclics such as amitriptyline or imipramine, are still prescribed not only for depression but also for chronic neuropathic pain. Depression itself is a risk factor for heart disease, so treating it is essential. But the way it is treated can make a great difference. These drugs have a hidden side. In many elderly people, they can cause drops in blood pressure when standing up, leading to dizziness, fainting, and even fractures. But it doesn't stop there. They can accelerate the resting heart rate, forcing the heart into continuous strain. And what is even more concerning is their ability to interfere with the heart's electrical system, slowing impulses and increasing the risk of dangerous ventricular arrhythmias. For these very reasons, they are no longer considered the first choice in antidepressant therapy for the elderly, even though they remain in use in some particular cases. The message is not that these drugs should be demonized, but that they should be used with extreme caution, always evaluating safer alternatives and carefully monitoring blood pressure and heart rhythm. Mental and physical health must go hand in hand, without the treatment of one compromising the other. Finally, there is an issue that in recent years has sparked intense debate within the scientific community: calcium supplements. For decades, the message was simple: taking calcium means protecting bones from osteoporosis. Millions of people have followed this advice, convinced it was a risk-free choice. But new evidence has raised important doubts. Calcium consumed through food, such as dairy products or leafy green vegetables, is absorbed slowly and naturally used by the body. The situation is different with supplements in pill form. High, concentrated doses cause sudden spikes in blood calcium levels. The problem is that the body cannot use it all to strengthen bones, and the excess can deposit elsewhere, particularly in the arteries. This process, known as arterial calcification, makes blood vessels stiffer and contributes to the formation of atherosclerotic plaques, thereby increasing the risk of heart attack. Some large-scale studies have suggested a slight increase in cardiovascular risk linked to calcium supplements, while others have found no significant correlation. The truth is that science does not yet have a definitive answer, but the doubt remains and cannot be ignored. The lesson, however, is clear: more does not always mean better. Dietary calcium remains the safest source, and any supplement should be carefully evaluated, never self-prescribed, and always balanced against cardiovascular risk. We have therefore gone through 5 very common categories of drugs: anti-inflammatories, gastric protectors, decongestants, tricyclic antidepressants, and calcium supplements. All have one thing in common: the perception of harmlessness, which actually conceals real risks for the heart.